The drug information internship is a really unique opportunity. I got to do a lot of things that students probably don't see in other areas. So I handled the drug product defects for the hospital. I got to attend a lot of meetings at the hospital, so the Pharmacy and Therapeutics Committee meetings, Product Vendor Selection Committee meetings, a lot of subgroups, so Anticoagulation Committee, vaccine use, etc. And so I think I got to see a lot of sort of behind-the-scenes pharmacy work, which was very unique and a different perspective, I think, than some of the other internships that are available.
I work at a community pharmacy, so I'm part of workflow as an intern, as well as some additional opportunities to counsel and work with patients to choose over-the-counter products, as well as counsel them on their prescription medications.
My internship experience in Dunedin was awesome. Most days I started off with working between 9 to 4 and then following up with classes with the rest of the students. Primarily I was with what would be our P3 students and doing a lot of variety of workshops and attending their classes, PharmD, therapeutics, and lecture halls at the hospital where they're all located. And when I was working in the actual pharmacy, I was dispensing medications, occasionally did some odd stuff such as ear piercing, things that you wouldn't typically see in the US here. So it was a wonderful experience.
I do a lot of technical writing. I help write policies and procedures. I do a lot of my work is on a computer. I also have a large part in home meds medication management program, meaning I look and track our medication errors and events.
I learned of this internship through upperclassmen who had the similar internships and through the internship panel in my P1 year.
Through the APHA organization, a subsect of it is IPSF, and just through going through meetings and a little research on our website just popped up.
At the Career Gateway, so there's definitely opportunities for P1s to find opportunities there as well.
From the internship panel held at the beginning of the semester, the P1 year.
Through the U.S. Public Health Service website.
Special skills I needed for the experience were definitely being able to multitask, really important for time management skills, really good customer service skills, and a lot of attention to detail.
Maybe just a cultural awareness of the Native American population and the challenges that they face obtaining medications and access to health care.
To be able to triage and pay attention to detail closely. A lot of times you would have a lot of tasks that you would need to be doing at once, and you had to remember exactly what you needed to do without forgetting it, because then it would cause a delay in the patient care.
I wish I had been better prepared in terms of understanding the type of workload and the pace that can go along with community pharmacy.
One thing I wish I was better prepared for was having a better understanding of what each drug did and what the indications were. A lot of times I would be making IVs and I wouldn't know which ones were most important to get out first.
I wish I had researched my site a little bit more, just the location I was at. It was a very rural area, and I didn't really prepare for the weather at all, so that was about it, just to research the sites because they're all so different.
Looking back, things that I wish I would have known a little bit more about is having a better understanding of Medicaid structure and the way some of the government insurance programs work and things like that.
The best thing that I learned and took away from this experience was definitely how to interact with patients in a community pharmacy setting. I had no community pharmacy experience going into this, so I took away a lot of experience in that regard.
The best part of the opportunity was being able to observe 5 different pharmacists. I worked under 5 different pharmacists and seeing what their paths were that led them to drug information, seeing how they functioned in a work environment.
Learning how pharmacy works from the business side of things. As a student and you're in the classroom, you're learning a lot of the clinical aspects and what it means to be a doctor of pharmacy, which is absolutely why we're here. But one of the important parts that I think students sometimes forget about is, in order to put those clinical skills into practice in a business standpoint, once you leave the college, there's a whole pharmacoeconomic standpoint that is also a major player in how we do our job.
I definitely believe that this experience influenced my future plans. I didn't really have any experience in this area before, and I think that I'm very interested in this area now.
I always thought I would become a clinical pharmacist, but I very much enjoy the administration, managerial aspects of my internship.
I think that my internship helped me realize how much I love that type of pharmacy, that how much I love community, and that there are certain types of pharmacy that, given my interests and my strengths and my wanting to interact with patients, that certain types of pharmacy may not be the best fit.
A single piece of advice that I would give other students is to really talk to everyone around you. Everyone has a different way of getting to where they are, and people can provide very unique perspectives.
So the one piece of advice that I would give to other students working in a community pharmacy that is a chain is to work at as many stores as possible. You have a lot to learn from the different pharmacists at different stores that work with different patient demographics, and it will make your career and job a lot easier if you have a really large breadth of experience with the different types of patients and their backgrounds when you're working in the future.
Student pharmacists are there to learn. And so if there's a role that a student would like to partake in, just ask the pharmacist and they'll be happy to help you out.
Explore non-traditional internships while you can. You only have really 2 summers to do it, and it's only for a summer. So if you try it out and you don't like it, you can move on to something else, but if you try it out and you love it, it's definitely an experience that you wouldn't be able to get otherwise.